Travers Lasik Vision Care is proud to offer Monovision Lasik, a LASIK procedure perfect for adults in their middle years who are struggling with seeing both far away and within close range. Monovision Lasik can reduce or eliminate the need for reading glasses.
When we perform the surgery on people that are over the age of 40, we have to take into consideration the need for reading glasses. Everybody on the face of the earth, once they reach the age of 40, loses the ability to see up close. It's a maturing phenomenon. It's something called presbyopia. When we do surgery, or even when folks are fitted with contact lenses, they're usually given two options. The first option is relatively easy to understand. We can correct both eyes to see clearly far away, and that will give good distance vision and good intermediate vision. But the up-close vision within arm's length reach, folks will still need the over-the-counter reading glasses. They're the kind they sell in the drugstore and in the grocery store because everybody needs them once we get into our 40s and older. The second option that we have is something called monovision. What we do when we treat the eyes for monovision is we treat one of the eyes, and it's usually your dominant eye, and we will determine which eye is your dominant eye in our office through some dominance eye testing. We will set the focus for that eye to be at distance, so that eye will still remain blurry up close. The other eye, we will set the point of focus to be up close, so that eye will be slightly blurry at distance. We call it mono, meaning one. You'll have one eye that sees clear for distance and one eye that sees clear for up close. It sounds a little bit strange, but the brain actually has a wonderful ability to adapt to monovision. Given time, most people will adjust to monovision. Some people will adjust a little more quickly than others, but usually by a couple of 2 to 3 months out from surgery, most folks have adjusted to the monovision. For most common activities, people do great with monovision. I do tell folks who do monovision that if you're doing excessively demanding activities, things in the distance, such as playing sports, some people with night driving may get a little uneasy with monovision. We can prescribe a pair of balancing glasses to make the near eye see far away. Up-close activities that can be demanding, if you're working with fine instruments or doing arts and crafts or reading for a very prolonged period of time, that may also require a pair of balancing glasses. But for most common things, daytime driving, reading your watch, reading labels in the store, people do wonderful with monovision.
Dr. Lori Travers of Travers Lasik Vision Care answers common questions about monovision.
How often do we have to reverse monovision? In a very small percentage of patients, I would say about 5 or 6 times a year, we do go in and take monovision away from folks who just don't adjust to it. I always say I don't belittle doing a second surgery, but it is possible for us to go in and treat the near eye to make it see far away if people just don't tolerate monovision for whatever reason. Yeah, is there some way that you can try out monovision? We can demonstrate monovision to you in a couple of ways. One of the simplest ways we demonstrate it is we use something called a trial frame. It's kind of an awkward pair of glasses that we put on your eyes, and we demonstrate with different lenses. We set the point of focus in one of the eyes to be at distance and the other one to be at near, and allow you to walk around our office, to walk outside, to watch the television, to read a magazine, to get a feel for what monovision would be like. Is there any downside to doing monovision? Most people who do monovision really like it, but it's a matter of having reasonable expectations. You do lose a little bit of the quality of vision, so you just have to realize that there is somewhat of a compromise a little bit in the quality of the vision, but you gain the freedom from having to reach for the reading glasses all the time. They've done studies that have shown that the average LASIK patient thinks about having surgery for 2 years before they actually do the surgery. And I say this all the time because it's true. The most common thing I hear after surgery from my postoperative patients is, why didn't I do this sooner? Um, some people will tell me, they were waiting for technology to improve. I think at this point, the technology has gotten so good, and our results are so um, just really amazing that I don't think there's a reason to wait from that perspective. The biggest thing that keeps people away is fear, which is natural. People think surgery on my eyes, and they have a natural phobia around the eyes, which is understandable. Contact lenses are not necessarily the safe alternative to doing the surgery. And being able to um, see clearly without having to reach for a pair of glasses or put on your contact lenses, the improvement in your quality of life, the freedom that you have from reaching for the glass or the contact lenses is phenomenal.